Today we're going to be measuring the supination and the pronation of the elbow. So what we're going to do is we're going to have the client bend her arm at about a 90-degree angle, and to keep the humerus close to the side of the body, we're going to ask the client to take her other arm and just hold it close to her body. Because we want to make sure that we have a 90-degree angle between the humerus and the forearm, and then we want to have the wrist in a neutral position. We will also ask the patient to hold a pencil in their hand so that we have something to measure when we actually use the goniometer. We'll take the goniometer, we'll make sure that the stationary arm is perpendicular to the floor, and then we'll have the moving arm stay parallel to the pencil. We'll put the axis of the goniometer on the third metacarpal phalangeal joint. Then we will have the client rotate her arm out, which will give us a palms up, which is our supination. So we'll have to do that. And then we look and see the pencil and the goniometer are parallel, and she's got about a 90-degree supination here. We'll put her back into neutral position and then ask her to rotate her hand into a pronation position. Realign our goniometer, and again we have about a 90-degree angle here. So then we will have her come back up into neutral. If you have a client that isn't able to go ahead and put their arm into the functional range of motion that we would like to see, we would just ask them to turn their hand in as far as they can. And we will again measure to see where we're at. And she is at about a 50-degree angle. And so we're just going to go ahead and take an umbilical grip on the distal forearm and just twist their arm just a little bit more until they are comfortable, and then measure again. And she is at about a 65, 70 degree angle there, so well within the functional range of motion.